Hello, hello. You're with me, Soraya Mia, and you're watching It's About Youth. According to the Malaysian Administrative Modernization and Management Planning Unit, in 2019, the ratio of social worker to population is 1 to 8,576. But before we get into this figure, to help us better understand the role of social workers, why they are so important, and the challenges they face, as well as the measures to address these challenges, we have Saskia Blume from UNICEF, the Chief of Child Protection in UNICEF, as well as Divaghar Voothayakumar, who is a social worker himself and is from the Malaysian Association of Social Workers, MASW. Thank you so much for joining us on the show today.
Thank you for having us.
So let's just better understand the role of social workers. There's a lot of misconception around, what social workers do. So perhaps I can begin with Saskia. Would you maybe help us understand what are social workers and what do they do?
Sure. So I think there are two important misconceptions about social workers. One is that social workers are often mistaken as charity workers, along the lines of doing handouts and doing charity that's one-off, which is really important. Volunteers and charity is very important, but social workers are a profession. So to be a social worker, you have to be qualified, you have to have an academic background in social work, and social workers really connect people that are in need of a social worker with the services and empower them to have long-term change. And I think the second misconception is that social workers may only be needed by what we call here the hardcore poor, right? That only those populations might be in need of a social worker. But anyone in Malaysia or anyone anywhere else might be in need of a social worker at one point in their life. They can be a victim of a crime, there can be violence in the family, there can be a tragic accident that results in a disability. So there are many instances where social workers really play a role.
So maybe you can tell us what you do and why did you choose social work as your profession?
Hi. First and foremost, thanks to Astro AWANI for having us here for this It's About Youth program. And thanks to Malaysian Association of Social Workers for recommending me to be a part of this talk. Currently, I'm working in Taylor's Residence, Taylor's University, as a community activator where I have to handle students, residents who are staying inside the campus by providing them psychosocial support if they have any issues related to stress, anxiety, depressions, or they feel bored, they don't have anyone to talk with, or they have a problem that has been plaguing them for a very long time. They can come and see me. I'll give them some solution tips and work with them with my trained social work background on those strategies. Other than that, I do events in the university for the residents, like events to bring them together, social inheritance among the university students. That's number two. And why did I choose social work as a career? Okay, there's a little bit of backstory. My grandfather is a postman during the independence of Malaya that time. So he have a lot of stories where he helped a lot of people. And he used to tell me when I was a small kid, whenever I go to school, he picks me in a bicycle and he tells me, okay, this is the people that I've helped, this is the people that I've addressed in my lifetime. So that already brought a spirit of humanity in myself, and it's actually already in my family's DNA. Like my parents, wherever we go, like temples, we help people around. So we have a high level of self-helping, and empathy as well, and also helping tendency. And I figured out after completing my STPM, I wanted to do a course that is related to humanitarian. At the same time as well, I need to get paid for that, because usually helping people, people think that it's free of charge, you don't get paid for it. But I was like discovering courses which I can find in Malaysia where I can get paid. So there was 3 courses. One is psychology, another one is counseling, another one is social work. So I found out social work is an emerging profession in Malaysia, and very well to be in 10 or 15 years it's going to be one of the most popular courses and a course that is in need in Malaysia. So I ventured into social work because social work is a course where we work with individuals, we work with families, and we also work with the community. So we work with everyone. So that encompasses my humanitarianism spirit. So that is why I choose.
Yes.
this
So
profession.
I'm guessing that you know, as a social worker, you would love to work with people. You know,
Yes.
all kinds of types of people.
I'm a people's
as
person.
well as you know having that problem solving skill.
Yeah.
But you know, as I mentioned earlier in the intro, the numbers of the ratio to social workers to the population is 1 to over 8,000. So that's quite low. What's behind these figures, and maybe we can compare, you know, Malaysian state of social work compared to other countries. Would you like to take this?
Sure, yeah. So definitely the figure that we have is too low, right? I think it might sound like a very abstract figure. If we compare this, for example, to doctors in Malaysia, so we have 1 doctor per 625 people at the moment. So we have about 12, 13 times as many doctors as social workers. If we compare in the region, Singapore, for example, has around, the ratio is 1 to 3,500 population. So they also have 2.5 times as many social workers as Malaysia does. So there's definitely, that gives you an idea that there are definitely not enough social workers. And I think what that does is, apart from obviously resulting in a big burden of work and long hours, it also affects the type of social work that you can do and the quality of social work. Because you can imagine here in Malaysia, the average case ratio is one social worker covers 53 active cases at any given time. That's the average. So some cover many more, especially in urban areas. And then, of course, if you have 53 clients to take care of, you go, what is the most urgent need? You know, where has violence already happened? Where do you need to intervene quickly? Where do you need to really have life-saving interventions as well? So what remains behind in that instance is where you could have intervened earlier, where there might be signs of abuse or signs of, you know, mental health issues, but you were too busy with the other cases. And then the second part is that social work requires consistent follow-up. It's not a touch and go, it's not a one-time intervention, but really you need to work with the client over some time. So if we have more social workers, then of course, you know, there will also be more time for each client.
Right, I understand. But what are the main challenges aside from, you know, the workload and not enough social workers and too many clients per se? Would you share some of the main challenges facing social workers in Malaysia?
Okay, the main challenges, the first thing is definitely the lack of recognition. Because Malaysians mostly they don't understand what social workers are. We are trained professionals, you know. I would say that social workers are not volunteers, because to be a social worker, you must have empathy. Okay, every time when we meet a case, we need to handle it with empathy, because if there's no empathy and care, you couldn't handle those cases. So due to lack of recognition, we don't have many trained professional social workers. So that's why we are fighting for the bill, so that social work will be equally a profession like a medical profession itself. So we need a recognition, because when we have the recognition, we will have a good financial investment from the government itself towards us. Yes, we acknowledge that we are a spending agency. We are solving cases, we are helping individuals, families, we are spending a lot of money, we are not making any profit. But when we don't have a good financial investment in our social welfare sector itself, that's when we have issues like one social worker have to take care of 53 cases. So that maybe in the future we have a good financial investment, we can have like 10 social workers to take care of 53 cases, where the problem will be quickly solved rather than it takes months or years. No? That is one of the challenges that we're facing. Another challenge that we are facing as a social workers in Malaysia is also the burnout. because the non-governmental NGOs, we are working like 24/7 tirelessly. There are a lot of 24 hours emergency cares, online cares, like Talian Ayat, Talian Kasih, if I'm not mistaken. And then there we have like befrienders. There are social workers there. They are working for free of charge, most of them. They are unpaid. Yeah, even I've worked in some of the crisis centers for free of charge for 24/7, and we do understand that in order to help, we don't get paid. And when we ask or seek for sponsorship from companies, they will say us that you are just helping people. Why we should get paid? You are doing it for voluntarily. So this kind of misconception, people don't really understand that social work is actually an important profession, like a medical profession itself. We are helping people, but we are also humans. Right? End of the day, we need to be compensated fairly.
And if I may add to that, I think the issue with that is an issue for the client at the end of the day, right? If you have social workers that are burned out or that are even not paid for their work, you can't guarantee that the quality is there.
Absolutely, understand. Yeah, so of course now the main problem is lack of recognition, and without recognition, there's also problems with funding and whatnot. Right, so as Diva mentioned just now, there was the bill or the social work profession or PKS bill. It was supposed to be tabled in Parliament last year in the previous administration, but right now, what is the status of the bill?
We know that the Nancy Shukri, new Minister of Women, Family, Community Development, had mentioned the bill early on when she took tenure, and lately the Deputy Minister had mentioned the bill again. So we are hopeful that this is a bill that will be tabled soon. I think to give a simple example, would you send a child to a doctor who is not certified by the Malaysian Medical Board? Probably not, because you don't trust that doctor is actually qualified, and you are worried that the decisions that doctor makes could have long-lasting impact on that child. So it's the same with social workers, because there are many different types of social workers. Some social workers play a key role in deciding, is this child safe to stay in this family or not? They're really life-changing and sometimes life-saving decisions that social workers have to make. So we want to make sure that social workers are qualified, and the social worker bill would actually establish the professionalization of social work. What we call it is basically translates into certification and registration of social workers, so that those that are social workers, have a minimum standard to meet. And if we look at the region, I think back to your earlier question, all the surrounding countries basically have done this step already. They have a social work professional bill. We're looking at Indonesia, Philippines, Thailand, Singapore. So this would not be, out of step with where the region is going as well.
So you also mentioned earlier that this bill, if it's not passed, it can also affect the clients as well, which includes, children or anyone who is affected. But how do you think the bill can actually impact both the social workers as well as these clients?
Okay, let me give you a very simple scenario that have been happening lately in Malaysia. There have been a lot of ongoing cases where children were sent to the childcare centers across Malaysia, where the children's being abused by the caretakers. The caretakers, some of them are age 18, some of them are in the 20s, some of them in the 30s. These people are not professionally trained. But why the parents are sending the children to an institution to care? Because they believe someone is going to raise them. So we have a bill, we can have social workers in these kind of organizations, in these kind of settings. We'll have social workers in school. We'll have social workers in childcare centers, so that we can supervise what need to be done for the children. The services will be improved, because social workers, we are very much aware of the services that we are giving towards, even can be a children, even can be a teenager. So we are the experts in the field of, as we said, that we are connecting families, individuals and societies. So every person's problem will arise. It's not the same problem. The problem that a client A comes with me, the template that I'm using for the client A, I can't be using for client B. I should be using a different kind of template. For example, for client A, maybe for his problem, I can just talk to him verbally and do some kind of counseling services and he will be fine. But maybe for the client B, I need to do some kind of psychotherapy. I need to do some kind of visual therapy. We need to do some kind of therapies, maybe like 1 session, 2 sessions, 3 sessions to solve their problems. These kind of things. So if the bill is approved by the government, we'll have more social workers across Malaysia and we'll have more stronger hands to tackle the social issues that we are currently facing. Because now we don't have solutions. The problem is there and people will say that this is a simple problem, why we don't have a solution. But what is the grassroots behind it? We social workers, we know that because we study about policy, we study about the system, like the micro, meso and meso, so these kind of things.
Yeah, I like how you pointed out, the example that you gave, which is the case of child abuse. And we've been seeing this a lot on the news, almost daily, that people are reporting on social media and everything. And it's, we actually are blinded to the solutions. That it's actually there. So when we talk about policies, though, what sort of policies could the government, implement when it comes to, this bill? How do you think we can actually tackle the problem?
I think the first step is seeing that the bill is seen through, because the bill would give us a framework of regulating social work. So it's a big step in terms of quality of social work. And then I think based on that, possibly looking at the ratio and also looking at what kind of supervision do social workers get. Because there's a lot of young social workers, which is fantastic. What we've seen from other contexts is that there's really, we need to have a strong supervision system as well, so that when there's a case that they haven't encountered before, or a very difficult case, that they make sure they make the right decisions and have someone to consult with, essentially.
I also just want to add on that point regarding this social work context. Now we already have so many acts, okay, like the Akta Kanak-Kanak, Akta Dada Berbahaya, Akta Domestic. We have a lot of acts. All the acts in Malaysia is good. It's really good on papers. But what we need is the body. We need a social work body to supervise all these acts. So now all these acts, they don't have like a mother. They're all working independently under the division of the JKM, under the welfare department. If we have the social work act, so social workers will have hands to regulate all these acts. So the body is there. So there will be social workers in literally in every department. Drugs, substance use prevention, there will be social workers. For crime, there will be social workers. For example, offenders, we have a lot of offenders facing issues of reintegration into society, right? So why reintegration fails? Because there's no proper social support. Who can make a good social support among community? Social workers, as I come to the first point, families, individuals, families and communities. So we can complete the system. So this bill can actually become the body for all the current acts which social work can encompass in.
We understand that the bill is in fact very, very important to at least be tabled and passed in Parliament. But there's this campaign, the Heroes Among Us campaign. Tell us more about this campaign. Would you like to go?
I can get us started. So it's something that the Malaysian Association of Social Workers and UNICEF had talked about, collaborated on. And the idea behind the campaign is really to let the heroes, the social workers, shine, to show the fantastic work they're doing, because more needs to be known about what is social work, what's the impact of social work to the general public. So I think that is really the main mission. So it's you'll see I think the materials are very uplifting and touching, and show very well what the impact of social work is. And then of course with recognition also comes the other issues that we had discussed, finding more support for the social work bill is one other step that we're looking at supporting with the campaign.
Right. So talking about social work and what social workers do, there's also this really important thing about social workers where you have to have self-awareness because you need to deal with all kinds of people. So maybe tell us how you actually practice that self-awareness so that you can be better at what you do.
Okay, social work, as I said, it teaches us a lot of values. One is accepting diversity. Okay, as a social worker, I can have my own set rule of belief. I can have my own principles, but that is only for me. But when a client comes, I should not intercept with it. I should respect my client's understanding, his background, his culture, his ethnicity, his belief and his norms. So I should be in a position to help him with his all kind of grounds that he's already having. I should not be like changing his beliefs. I should not be like changing or conveying my thoughts to his thoughts. It doesn't work that way. His thoughts are his thoughts, my thoughts are my thoughts, but we can work together and we can create a solutions. For example, respecting people irrespective of their gender and cultural background. We are so open to so many things. Even there are some things are very sensitive, but when it comes to a personal level, not in a societal level, when people come to a personal level, we need to accept their differences. So this is very much very self-aware. Second is do not judge anyone. We do not judge people because everyone have their own problems. Maybe a person who comes, like as I said, a client that comes to me with a substance addiction, we might think that, this person is lazy, that's why he's having substance addiction. But the real story is the wife is actually torturing him. The wife is actually abusing him verbally. The wife is actually having some kind of mental health issues which need to be diagnosed. Okay, so these kind of things. So do not be judgmental with the people that we see, with the problems that they come to us. So this is something that I always tell myself. Number 3 is if you already decide to help them, just go and help them. Do not have second thoughts, you should help them or not. Because in most cases, when we want to help people, if we have second thoughts, we will never help them. Because our mind will tell us that we should help them or not. We should reach them or not. Example situation, I can tell you that in Malaysia, many restaurants that we sit, many people will come and sell us tissue papers. They will sell us food. They will ask for a sedekah, like 1 ringgit, 2 ringgit. Usually what I will do is, I will immediately give them. Because if we have second thought, we will start to think, why these people are actually coming to us and begging for money? Why we should give them money? And that's it, we won't help them.
Right. So if
this
you want
kind
to
of
help,
things.
you just gotta go.
You just gotta go.
No
The
second
sympathy is very
thoughts.
important.
That's right.
Yeah.
Now, for the about 1 minute that we have left, how would you, aside from the empathy side of the social work, there's also the career benefits as well. So how would you encourage more youth to get into social work? Maybe you could just.
Yeah, I think you said it all in terms of how enthusiastic you are about social work, right? But no, in all seriousness, we have around 400 to 500 social work graduates a year. This is a rough estimate based on, I think there's 7 universities, 2 colleges that offer social work degrees. Now, what do they find once they graduate? I think that is the important question to ask. Do they get adequate career opportunities, adequate pay? Do they face a work environment where they don't have to suffer from burnout? So I think as much as we want to encourage people to become social workers, we also then need to make sure that they find the conditions to remain social workers. And it's not just some people that might burn out and drop out within Malaysia, but also because Malaysia has such a high standard of social work education, there are social workers that work in other countries. There are social workers in Australia, there are social workers in Singapore who come from Malaysia and do social work there.
So there's the whole brain drain issue all over again. But, well, that's all the time we have. Thank you so much for sharing all of your thoughts and experiences. It was very lovely to hear. But that's all for this episode today. Thank you so much for watching. I'm Soraya Mia, and we'll see you again in the next episode.